I've been seeing this case for more than 1 year now, and he comes to me twice a week for therapy, and it's a face-to-face therapy, right? So I'll just give a bit of a background. This is a 20-year-old male patient. He's of thin build, and in fact my very first impression of him when I met him for the very first time when he came to me was that I found him to be very awkward. There was something about him that when I saw this person, when I interacted with him, I found him to be awkward. And I got this feeling that he's not really made for therapy, and though this was not as such a very conscious feeling, I would say, it was more of an unconscious feeling. And now when I thought about this and when I looked back, I also somewhere unwittingly tried to discourage him a little bit from going somewhere else, from not coming to me, kind of thing, because I had the sense that he would not be probably a very good candidate for this kind of work. About his childhood, he said that the childhood was spent in a very large joint family. I mean, there are these 4 people in the nuclear family, he, his sister, and both the parents. He is the older child, the sister is younger to him, but they were living in a very large joint family where his uncles and everyone from the grandfather's side were there, right? And then for the last few years they have been living as a nuclear family owing to some family conflicts between the brothers. And although he says that there are these conflicts also, but still, like, the family has bonding and they interact a lot with each other. He reported that he is not attached to his parents or to his sister or any family members or anyone, in fact. He said that he has people whom he calls friends, he has a social circle, he has everyone, but he is not attached to anyone, kind of thing. And he also reported that every relationship had been extremely painful for him, because he said that he gets this feeling that in any relationship there comes a point when he has to simply disregard himself or crush down himself to be in that relationship which he does not like, and then he eventually withdraws from the relationship. He does not terminate the relationship, but he would just cut down his involvement and withdraw from the relationship. And he reported feeling very empty from inside, and he felt that that there was no joy, no excitement, and there was never any such feeling that he has experienced in a long time. He like to illustrate this. He mentioned that that I do give birthday treats and I do celebrate New Year and I do celebrate festivals, but that's what I do because it has to be done. I don't feel that it's something joyful or I feel happy doing it. It's just like that it's a social obligation, it's a compulsion. People are expecting that this has to be done, so this is kind of done. And he also said that he actually sees no point in doing it, and in fact he feels a very strong hatred for himself when he does such things. And a part of him always criticizes him and rebukes him in these moments for being very, very fake. That he says that a voice tells me that, oh, you are not really enjoying it, you are not really into it, you really don't want to do it, so why the hell are you doing it? But still I kind of do it. About his education, he's doing B.Tech, which is an engineering degree from a private college, and is performing poorly at studies simply because he says that he does not study. The same attitude is towards the study as well. He says that I don't want to kind of really do it, but I'm into it, so I have to sort of do it. He shared this fantasy that he actually wanted to be an actor, but his family discouraged it. And when he shared this with me, I also had a very similar attitude, because I just felt that he's like so much withdrawn and so much how could he be just kind of how could he just want to be an actor? That was my sense also. And About his childhood, he says that he was very good at studies initially. He was a very brilliant boy, and about very early childhood, he also recalls that he was very playful. That he used to kind of laugh, have fun, play, and throughout the last 1 year, when he has been in therapy, he has predominantly talked about several instances where both his parents tried to rebuke him by saying that he's not good enough. That has been a very strong experience. Further, he also recalled moments that whenever he was being free and playful, like he said that once they were at a railway station, so he was just, laughing and enjoying, kind of thing, because he saw something, and the father came and he just gave him a tight slap, and he said that what's there to laugh about, kind of thing. And there have been like several such instances where he got scolded very badly, and or where he got actually beaten up. He harbors intense rage towards his family, and there is also a very intense guilt due to this rage. So he would get negative emotion. Then he would also really, he would tell himself that you are really bad to think like this, and that you are the one who are bad. And from his interactions, it also came across to me that his parents, they seem to carry a very strong notion of how a child should be, or of how they wanted their son to be. And whenever this person seems to deviate from that image, they, to my mind, it comes that they just could not probably tolerate it. They found it hard to tolerate that. He also shared this instance that he was often compared with other children. Whenever he did well in studies or whenever he scored well, he would come back. So his mother would often say that, fine, you have got good marks, but see this person, he is also a good student and into sports. And interestingly, these children were usually at least 8 years or more older than him. He was being compared not with people his age, with people older than him, people who were 8 years older, 10 years older, or even more, kind of thing. And about a lot of this, he also says that till a certain phase, I was just into this and I was living this. I really did not know what was this, and it's only now that I've started thinking about this. That's what he says. As far as our sessions are concerned, he's very regular in the sessions, extremely regular. He always is 5 to 7 minutes before time. He's also very reflective and open in some sense, that he would really think about what's happening. He's also very frank in sharing his feelings, kind of thing. But despite this, in the initial 10 months or so, I kind of found our interactions to be very formal. That was my feeling, that there was something very formal about the way our interactions were. And interestingly, though I tend to be slightly informal while doing therapy, with him I also kind of, that was my experience, that I was also saying and doing things quite formally somewhere, kind of thing. And what I mean by formal is that, the image that would often come to my mind is that as if someone is reading a piece of news to me, like as you would see in a, if you see like those old-fashioned news readers would be just, saying everything in a monologue, without any modulation, expression, emotion. So that's how he talks about himself and his entire history. He'd be talking about extremely traumatic emotions, rage, everything, but it will be in this kind of a newsreader manner. Yeah, and I had the sense that there was no emotional feel to whatever he said at times. He came to me after doing quite a careful research, because he had been to 2 psychologists earlier, and he terminated the treatment with the first one after 3 sessions and with the second one after 2 months. And what he simply said was that that he had a feeling that he could not express himself over there, so he just kind of stopped the treatment. And once again, when he told me this, I was actually, I had this sense, oh, he's going to be here with me for also a month or 2 months, and maybe it's like that, kind of thing. That's what came to my mind. And he approached me because he actually kind of found out that I was I had training in psychoanalytic therapy, and I had also worked with traumatized people. So he came to me with this kind of a mindset, that maybe with these experiences I will be able to help him. About his strength, he is very well read in philosophy and psychology, and so he knows at times what he's talking about, and he came with an expectation. That was the image of therapy that he brought in. He said that it's as if that that myself is like a book, and there are certain very bad, unwanted, ugly pages in the book, and I'm hopeful that you will just help me tear out those pages and remove them. That was the metaphor of therapy that he brought. And in our sessions, as I said, they were like very formal, but whenever there would be such moments, when the formal structure went slightly missing, then he would feel extremely awkward, and what I mean by that is that if the session is like this, that he knocks at my door at the set time and comes in, he talks and he goes away, so it's fine. But if, say, he is early and I simply walk out of my room into the waiting area, or I'm going somewhere, and if we kind of meet somewhere on the way, he would get very uneasy. He would get very uneasy, and in the initial stages, he'll just see me and he'll actually almost run away in the opposite direction, kind of thing, and then he would come back, and he would also at times say that, that when I see you like this, I feel extremely awkward, that, that what should I be doing in that situation, and so I do this, And interestingly, somewhere, for in the initial months, I also saw this parallel kind of a thing in me at times, that I would be slightly forgetful, about him, like I am supposed to give him a monthly bill, of the sessions that he has, because it's for some insurance purpose, and I would kind of, like I would forget to make that bill, which is really not the case with, the way I normally am, kind of thing, and I think in the initial 2 months, I actually, I told him twice that, I've forgotten today, I'll get it the next time. And the next time also this happened, and the third time also this happened, until I kind of, had a feeling that, what is really happening, kind of thing. Yeah. And so I did get this feeling that, from my initial impression of him and this, there are these two, sets that I have. On one hand, somewhere I find him actually very gifted in some ways, very reflective in some ways. I look forward to working with him. But there's also this undercurrent where I think I sort of, there's a part of me, which kind of is probably wants to, be distant from him, away from him, kind of thing, not keep him in my mind, things like that. And when this kind of came to my mind, and I then became much more attentive, that I stopped, I tried my best that I don't repeat these things, kind of things. So that was there. And now I'll just come to a very recent phase of therapy. So, which is like after this. This was the work that was happening for the for the initial 10 to 11 months. That he would just come. He would be simply talking about his past. There would be a narrative. He would recall few things, and then he would just go back. He would rarely talk about his present and what was happening now and what he was doing. He would not talk about his course, his college, his exams, or whatever, but he would just talk about this and leave. Yeah. And then came a phase when he became totally silent. In one particular session he became totally silent. Then he came to the next session, he was silent, and then when he came subsequently, he told me that, look, I've really run out of the material, because I think I've told you everything from my this past. That's complete. I've run out of material. And I had nothing else to say, so he requested, he said that, look, you are a psychologist, I know, and there are many interesting tests in psychology. So there's nothing else coming to my mind, so why don't you give me thematic apperception test or Rorschach so that I could, fill in my time. So I kind of, I smiled and I explained to him. I said that obviously that is a good way to occupy time. I mean, if I start giving you tests and I have, quite a lot of them to fill in that time. But I said that, I mean, obviously my sense was that there's something happening, kind of thing, and I should not kind of, let it go away. So I said that, I mean, that surely is an option, but if it's not too difficult for him, so let's try and see that what is happening, and what is this silence about, how is he feeling, and where are we now, and so I told him, let's just stay with what's happening and hopefully see what comes up. In the next session, then he shared that he felt scared that if he continued to be silent, I would tell him that he was wasting my time and I would throw him out of therapy. So that he, so he said that that's why I feel that I should do something constructive over here, kind of thing. And so I obviously kind of, discussed this thing with him more, that why did he feel, that I would throw him out of therapy. Now, another interesting thing, I'm quite confused about this aspect, that whether this is a strength or what it is. Whenever I kind of discuss something transferential with him, that whenever I would say something like this, that fine, you have this impression, so what makes you feel like this, and or what about me gives you this sense, that I may throw you out, or something like that. He very quickly says that no, look, it's not about you, it's not about you. I know that this is going to happen with any person, or it can happen with any friend or any other psychologist whom I see. It's not about you, kind of thing. So that's what he says, which on one hand makes me feel that he understands, he's quite reflective, but on the other hand, it also, makes me feel that he is not comfortable probably in experiencing these feelings in relation to me and expressing them, in a very, in a very open manner, kind of thing. But I haven't shared this thing with him. Anyways, so what happened is that when we discussed this fear, he felt slightly at ease, and he said that he would, try and look at whatever was happening. And so he agreed, and then what happened is that there actually came a phase that for the next quite a few sessions, it was significant times, he was absolutely silent. He would come for the session, he would sit across, the entire session would be like, both of us will be silent, he will get up at, when the session end, go out. The next session he would come on time, and, this like that. It was a very much testing time for me, kind of thing, because I somewhere actually was also anxious that what was happening, and I wanted to, kind of ask him that how you're feeling, what's happening, and where are we going. But my sense was also this, that that I also had this in mind, that he already kind of given me the sense that it should not be that I'm expecting him to speak or expecting him to be in a certain way in my work with him, because I had a sense that if I give him that sense, then then his fear would be sort of kind of confirmed or reinforced, that I also want him to maybe speak or maybe do psychological tests or give me some interesting data, and I can't really be with his silence. So I kind of I tried my best to be kind of silent in those sessions. I would also not really say anything. Only once after then. And my general feeling in these sessions would be that one, I would be have this confusion. Secondly, I started feeling extremely sleepy in these sessions. Interestingly, that was not a boring sleep, so that's the interesting part. This was a very blissful sleep. There's something very nice about this, sleep. And I mean, it would be so heavy that I would have to, at times I'll have to move myself, I'll have to drink water to keep myself up, because, and I so dearly wanted that, I should have put him on a couch, so that even if I slept, it could have been fine. But then we were like, face to face. But when I would feel sleepy, so the fantasy or the feeling or the memory that would come to my mind was, that as if I would recall this time when I was a baby, or a very small child, and then someone would really hold me, and I would be kind of, sleeping in that person's lap, So that was, and this whole sense that as if you are, slipping into some kind of a fusion, which is a very deep sleep, that you are held by someone, and there was something very peaceful, deep, and blissful about this. So then, after a few sessions, when the silence was continuing like this, so I thought that I just asked him once. So I said, look, I'm fine with whatever you wish to do in the session, and it's your session. Whether you stay silent or you talk or you do something else, I'm happy to give you that space. But I said, I'm really curious that what does this silence mean and how you feel about it, and whether it is helping you in some ways or it is not helping you in some ways, or what's happening. So at this moment he smiled and he said that though he initially felt extremely scared to be silent, and he always thought that I expected him to do something, now he had developed comfort with it, and in fact he enjoyed silence. And he told me that he slips into fantasies, he plays with his fingers, and he actually finds this silence very peaceful and very good. He said that there's something healing about this silence. So I did at that time recall in my mind that I also go through a similar experience in his presence when I almost start slipping into that sleep. And then in one particular session, this again happened that after keeping silent for a long time, he all of a sudden asked me about a room freshener which is lying there in my room. That was after a long period, of he asked about this. A part of me thought of responding in the usual way as you would do in a psychodynamic therapy, that you would kind of ask that, fine, so what comes to your mind with the room freshener, or what does it mean to you, what does it signify, or tell me more about it, what do you have in mind. Here, I don't know, I somehow felt shaky to take this up, because I was like that he has been silent for so long, and now this is the contact that he's making with me, that he's asking me something. So I did not, I at least felt at that point of time that he is wanting to connect to me, and maybe if I kind of respond in a very standard way, that may come across as cold to him, that I was pushing him away. So what I simply said here was that I kind of I also smiled back, and I said that it's a room freshener, and he smiled back. Then he was silent again, but then after a while he said that he wanted to ask me a few more things, but felt scared that it will be unprofessional and it will be not permitted. He said that I may get angry, and when I asked him what gave him that sense that I may get angry, he once again said that, look, it's nothing about you, that's an inner sense that I have in all relationships, and that's what I would have, that has got nothing really to do with you. So here at this moment, then I did share this feeling with him, and I said that that I have a feeling that till now actually interaction has been quite formal at times, and maybe a part of you wishes to be spontaneous over here with me, but you feel very scared of my reaction. You feel that I would not really kind of welcome it, or I'd be very I would not really like you to be spontaneous. He agreed to it, and then he said that he wanted to be kind of free. And then after a while he shared several instances from his childhood and teenage where people forced him to leave his perspective and take up theirs. He says that in all the relationship that happens, that whenever he's interacting with someone, after a while he feels compelled to take up that person's perspective totally and leave his, and then after a while then he feels complete loss of his perspective. So in the session also he expressed a fear of being controlled. He said that I have the sense that if I get close to someone may tamper with my mind. I once again said that could be another reason that why, despite really wishing to be spontaneous, he was unable to do so. He agreed to this, and he said that it could be like that, and then I kind of also asked him, I said that, that for almost a year we have been discussing very traumatic incidents about your life, but when you talk, I at times really notice, that where are your feelings, kind of thing. And he thought for a while, and he said that, look, there are a lot of feelings inside me. I feel very enraged, I feel very hurt, but I usually keep them to myself. He said that this was because he felt expressing pain was being weak and he hated it, and he said that also if he expressed it, he could get very abusive and out of control, if he started expressing those emotions, and so he was keeping it all inside very tightly, So here I said that we need to, find ways to reach these emotions. But I think that when he said that he could be very abusive and assaultive, I was somewhere scared of his, rage and whatever was inside him, kind of thing, because I had that sense. In the next few sessions, we talked more about his fear that, that he could be aggressive towards me. And so we then discussed several themes around it. So one was that this was the pattern of relating he had seen in his life. He felt so put down by everyone that the only way he could think of an interaction, or the only way he could think of holding himself together, was by kind of putting this awful experience into someone else. Secondly, he also felt scared that if he tries to get close to me, I'll be put off by it, just as his parents were, and that he would, once again get re-traumatized. By discussing these fears, he seemed to feel slightly more comfortable and became somewhat more open in, the next session, which was the second last session, and then I'll just come to the last session. So in the second last session that we had, he just came. He was actually very spontaneous that day. He came and he smiled. He gave me a very big smile, and he complimented me on my dressing sense. And he said that I have a lot of passion in whatever I do. He was saying that I feel that you have a lot of passion in whatever you do. You are a psychologist because it seems that you always wanted to be a psychologist. It was not that you accidentally came to this, and that you are in a lot of control of yourself, and you do things because you enjoy them. It's not that because you have to do them, kind of thing. He also said that all this was in a very stark contrast to people he had seen in his life. And he also then reflected back. He himself said, initially when I came to you, I felt extremely scared, whenever you would understand me, because I used to think that no one can really understand me. But over the last 1 year, he said that I find you different from everyone, and I have started relating to you. He shared an inner image where he saw himself standing in a round hall full of doors. He said that all the doors are the same, but he was beginning to see that one particular door which represented me was different. He said he was feeling a sense of trust and positivity. In relation to this, I had several thoughts and emotions to what he said. Firstly, I kind of felt slightly amazed by kind of his you could say his intuitiveness, because what he had shared about me, I mean, a large part of it was very true without me having mentioned to ever to him that why I was a psychologist or what I like doing or not doing, but that was somewhere quite true. And the whole experience was that as if he could somewhere see through me and almost that he had seen very well through me. Secondly, I felt happy that he had found some hope in our work, because I also recall that when I long back discussed this case with someone after initial sessions, so that person really told me that it was a pretty hopeless case because this person had no good attachment in his life, I mean, there's no one in his life as such. And thirdly, I also experienced being put on a high pedestal, which no wonder felt good, but it also felt scary. It felt quite scary to be somewhere, admired, to be held high, kind of thing. There was something scary about that. So that was where the session ended, and then this last session. So after this session, when he came in our last session, which we have till date. he seemed to go back to, like, the old self. He came in and he was, quite silent, and then he started this session very reluctantly by saying that the guard near my room was trying to be friendly with him, and he felt very awkward and very scared, by the guard. Though he again said that that's okay if the guard wants to be friendly with me. I understand that's not a problem with me. That's a problem with me, but not with the guard, kind of thing. And then he went on and said that he prefers loneliness and being with people was just too much. So here, because there was such a stark contrast between the two sessions, so I just asked him. I brought into his attention our last session, and I asked him that, look, that I wonder whether this has something to do with, what happened in the last session, that you felt extremely close to me, and today you are again talking about, that how closeness is very scary and how you would be rather alone, kind of thing. So he thought about that, and he said that indeed he felt very scared after the last session we had. He said he had a feeling if he had given me too much of a power by admitting that I was important for him, and now I might coerce my views on him, kind of thing. And he once again quickly added, when I tried going further into it, that this had nothing to do with me, but this is the general sense he would have with everyone. So that's actually very interesting, that you touch upon the transference, but you can't really go, a lot with it, because then you get to know that, no, it's not about you, kind of thing. And and then he also said that in any new place and relationship, he feels comfortable in the beginning, but then withdraws into himself, because when his perspective differs from people, he cannot hold his ground. And their perspective becomes his perspective. He also said that he was feeling overwhelmed in the last session when he was talking about me, which he now felt to be very stupid and sentimental. And he also shared that whenever he has been emotional in his life, he got this message, that people around him would generally say that you are being an emotional fool. And so that he does not feel very comfortable about it. So stop here. Yeah. Would you like to ask him? I think you said that we can take questions from them first, or comments from them, and then. Fine. So now we leave it open to the audience if you want to ask anything more, if you want to share something, comment upon it, and then I would hand it over to him. Yeah, please.
So I read somewhere that in order to, if you have to become a psychoanalyst and practice it further, so you have to go through psychoanalysis by yourself first. So is it true, and why is it so?
Okay. Okay, see, I mean, I will obviously respond to that, but I mean, if we have no questions specific to this case at the moment, so that would be there. Obviously, that we could go into, I think that we should answer. Yeah.
Sir, I'm confused. Like, the patient himself knew so much about himself and about psychology. And as I said, at the end of the session, he went back to where, like, basically he started everything. Except for you, there was no door that was open for him.
Right.
So how does therapy help in such a situation?
Okay. She says the patient has a good insight about it. But after this one experience, when it was close to me, he went back to being able to say, so how does psychotherapy? Okay. I think that he would surely give his comments, but that's what I would kind of tell you from my experience, that it is not really about maybe knowing yourself so well, but it's about, like, when work happens, it actually happens in repeated cycles. That that you try what you are scared of, you try, you succeed, then a strong fear comes up, it overpowers you, you go 2 steps backward, we kind of think through that, again the person musters courage, and that's how, like, the progress really happen. With some patients, it's also interesting because we talk about an intellectual defense. Intellectual defense, it's very prominent among psychologists, that you know everything so well, you know yourself so well, you understand everything, but there's something missing, that by thinking too much you are kind of, keeping away from your emotions, so that also happens with a lot of people, especially with people like this who can come and tell you their entire life story, but just like a newsreader, kind of thing, so it's a lot about a mixture of intellectual and emotional insight that one needs to have to kind of go further. And in therapy, it also the person would go into these, because see, it's also that you have to work through the fears and through issues in this interpersonal context, of the transference.
The kind of person that you mentioned him to be, there are a lot of people who feel like him, a lot of people who go through such things.
Right.
But what do you think made him come to therapy? Because a lot of people don't really choose to come to therapy or to help themselves this way. What do you think made him take the decision of taking therapy?
Okay. I think one is that he, there's a lot of suffering in his life, a very intense suffering. In fact, through these sessions when he has been, reporting all this, and at times I see no emotion, so I get to feel a lot of emotions on his part, that I would kind of at times be really, moved to a lot of fears or tears, either way. So I think that one thing is suffering. Secondly, if you see that no matter how this person's life has been, he's someone who is very motivated to do something about it. He reading philosophy, reading psychology, went to 2 psychologists, it did not click, still had the courage to come to a third one, kind of thing. So so it also depends a lot on how you are. So he's someone who is really very motivated and who also has, as someone said, who also has some insight into what's happening, whether it's good or bad or whatever his insight. He has some good insight into what's happening in his life, kind of thing. So I think that these 3 are very important factors. That's why he came. Yeah. Neha, you were asking something.
Actually, I was wondering if you were holding back a lot of your own interpretations, but somehow if you could as a therapist tell us what was your sense of the client and what would his issues be in the context of his family. Since I've understood the fact that you were holding back for the client because you wanted to provide for that holding environment, I just want to get a sense of your own contextualization of his self.
Okay. See, my own understanding of the issues in his life has been this only, that I think that one very important issue has been that this entire message that you are not really good, that has been given to him very strongly in multiple contexts. That even when he did something which was actually good, so he was never acknowledged, that you've done good. He would be said that, so you've done this, what's there to be really happy about? You see a cousin who's 80 years older to you, he also does well in academics and he also plays, so you really aren't doing much, So I think that really has led to, on one hand, an experience of shame and awkwardness about his own self, that I'm not really good on one hand. And then also this, I think somewhere also a lot of rage, that my parents have not really sort of acknowledged me. They have not kind of they did not allow me kind of to be what I wanted to be, kind of thing. Because he also does understand this bit, and he says that whenever I did something like that, or that I was kind of treated like this. Thirdly, I think that with the kind of experiences he has had, there's a lot of dread of being intruded upon, and of like something very aggressive and intrusive happening in relationships. That whenever he starts getting close to someone, that there almost comes the sense that he has to take on that person's perspective, otherwise he can't be in the relationship. So I think he approaches relationships with that kind of a sense, and that's why he kind of never feels comfortable in the relationships and would kind of withdraw. And I think lastly that even when he has some negative experiences in relationships, he holds a lot of rage and anger back to him. He would really kind of communicate it to the person. So that also, so in that sense he kind of would withdraw very passively or something like that, or would exist in the relationship in a very false kind of a manner, which he generally does.
Also, the moment when he almost idealized you and you somehow handled it in the next session, you became anxious about that. What was going on in your mind as a therapist in terms of reflecting on, did you question, did I handle it appropriately? I understand you're still in therapy with him. But that was the sense that, I don't know if you were expecting as a therapist that now that we've gotten so close, then the next session was silent.
See, about my feelings, when he came for the next session, I was very dismayed, that we had a very nice last session and here he's back to like this, so I was suddenly very dismayed, and I actually had this, I experienced some kind of a rejection also, that was my inner experience, but I did take this up with him, and I did ask him, I did bring him to his attention, because he talked about the guard near my room that, that who was trying to be over-friendly. So I didn't straight away interpret it to him that that you are kind of scared of getting close to him, but I kind of made him think on it, and I said that that look, you were like this with me in the last session, today you were like this, could there be some connection, and if yes, so he did talk about so then he himself analyzed and said that he was very scared, and that what all was kind of happening. So that's it. Anything else, or
how did you realize that he had been enjoying silence as a healing? Because he was a person that was always want to express himself.
he's asking that how did you enjoy silence as healing? That was not my inference. That's what I asked him, and he said, but I would say that I was somewhere, this silence part was very difficult for me. One, because obviously it is very awkward that someone comes into your room session after session, and you both are sitting and looking at each other. You also start feeling sleepy at times. What really to do? So it was also, I was also damn scared of going off to sleep in the session, more than anything. But I think even when that silence was happening, though I had a lot of questions around it, and I was also thinking that what is really happening, but I had this sense, that, because also in this session you get an intuitive sense, so my own feelings in that silence were that I obviously had these anxieties, but as I said that I was somewhere having very, nice, peaceful and blissful feelings also, kind of thing, So that also gave me a sense that maybe this isn't such a disruptive thing that's happening, kind of thing. And actually, when I finally did ask him about the silence, he said that that was something very peaceful, and he was also finding it to be very blissful. So that's how kind of I thought about it.
Permanent one or temporary duration so that silence and joy?
No. Of my feeling.
No, sir, this feeling.
Yeah, he said that he was absolutely enjoying the silence. That that once he was sure that I'm not going to throw him out of the therapy, he was really enjoying the silence. He said that he enjoys coming to the sessions and being silent. One question. Yeah.
I'd just like to try and understand a little more clearly the silence that you're talking about. I feel that from a patient's perspective, if a patient is not very willing to share at one point of time, and the therapist doesn't force or doesn't push him for to come up with new things, it kind of builds the rapport in a way, maybe not in a very aggressive, active way, but passively it makes the patient feel more accepted and gives him the time to get comfortable with the therapist as such. I don't know how many of you have seen the movie Good Will Hunting. there in that movie they show this process very nicely, where the therapist and the couple of times, therapist and the client, they don't have anything to say to each other, and the therapist kind of goes off and wakes up again. But it is also a part of, a very integral part of the therapeutic process.
True. I think very,
About the rage, because there was a point when you said that you were scared.
Of the rage, yeah.
I was thinking about how is that felt like in the session, and what does it feel like for you when you think that you can do something where there are these fantasies that he has.
See, I don't get when I think of his rage, and it has till the moment not come in front of me. It's also interesting that with him I don't get a fantasy, that at times patients will get a very clear fantasy. With some patients I have this fantasy they can, they will shout in the session, or they'll, bang, or they'll leave, or, something like that. With him I don't get this sense, that what could happen, but it's a very diffuse kind of a feeling, that when you are like, that there's something very intense, and you feel sort of scared of that something.
There's something about this attachment where he's keeping it safe. It's not about him, but it's actually very interesting that it could be about you, or he can attach himself by saying it's about you too, but he doesn't.
I think, I don't know, my sense is that he tries to save me from that by saying that it's really not about you, kind of thing, and I can have this feeling about almost everyone in my life, so it has nothing to do with you personally, kind of thing,
Don't feel it.
Don't feel it, right.
Yeah, I was wondering, Pulkit, that in the siblings, where is he?
He is there are only two, the brother and the sister. He's the older child.
Because I was wondering, in terms of feeling, a kind of the feeling that I get is that he has a feeling of getting strong, and he can't keep his ground.
Mm-hmm.
And then when he says there's nothing to do with you, that's too difficult for him to actually say it. That actually he, like in that earlier case, which Sir Roland was saying, of being taken over in a way. That as soon as he goes into any relation, that it may have had to do with his earlier years.
True.
And this feeling that, okay, the minute I come, I won't be able to keep my ground.
True, I mean, which has been there, that the entire family environment has been such that, there hasn't been any ground for him actually, kind of thing. Which is like very true. There has been no ground for him.
I somehow feel that the statement that he comes up with all the time, it's not you and it's me. It depends on the context. Like sometimes he uses it like a defense, sometimes he uses it like, to make you feel better about yourself.
Right.
And so somewhere, he feels that there's some connection with you and he wants to maintain it, but he doesn't want himself to get too attached to you so that it might hurt him. Because he fears that backlash, because somewhere throughout his life he feels that all of his thoughts are not good enough and people can change him. And he doesn't want that, because somewhere I feel he wants to be since he's so motivated to do so many things, that means he is also somewhere trying to take these steps to make himself better in his head. So that is this whole
Okay, then I'll now invite Dr. Roland for his comments. You can shift.
Well, this is a very interesting case. I think very sensitively presented and with some wonderful questions from all of you. First, before I get into the case, let me answer this one question that was put aside, an important question, but not necessarily relevant to the case. Okay, to get that out of the way. Why, if you become a psychoanalyst, do you have to go through your own personal analysis? I think the reason behind it is it's assumed that none of us are completely free from unconscious conflicts and issues, and the more we can become in touch with them and resolve them, the better we are with patients, that you'll understand more what goes on inside of patients. That's, I think, the basic reason. It used to be, I know in some institutes, that the analyst who would conduct the analysis with someone in training would have to report to the institute how their analyst was doing. We felt at our institute, and now it's the same at others too, that this was a very bad idea. It's not a case of being evaluated in your analysis. That's one thing that will prevent an analysis from being at all effective. So that it should be kept confidential, and the person in analysis should have no fear whatsoever of being evaluated. And anyway, let me get to the case now. This is, I said, a very interesting case. Let me tell you I think Dr. Sharma described very well what he did, and I think a lot of it was very effective. Let me tell you a little bit my understanding what went on. Patient comes and for a long time presents himself, Dr. Sharma says, in a rather formal way during the procedures, telling all about his past, nothing about anything in the future, or in the present, I should say, what's going on. In other words, as if he's being very dutiful, doing what's expected in psychoanalytic therapy. Then all of a sudden one session he announces, I've run out of material. I've told you everything. You know, in effect, why should we even continue? Now, often this comes up in a somewhat different way in my experience, and that is the patient talks about problems they're having this problem, they're having that problem, they're having another problem, we work on a problem. All of a sudden one day they come in and say, you know, on the whole I'm feeling a lot better. I don't have any problems to discuss. Why should we continue? Now, what I find with that is it's a very subtle transference that's going on, and the way I understand it, it's telling you that the relationship I've had with my parents is a very conditional one. That only if I'm a certain way will I be loved. So that in therapy, only if I tell you all about my past will I be an accepted patient by you. Or only if I tell you my problems do you accept me as a patient. So it's, and from what Dr. Sharma described, it tallies very much with the parents' not only high expectation, but you have to live up to these expectations, otherwise we don't love you, we rebuke you, etc. That becomes now lived out with the therapist in this form of I've told you everything, I have nothing more to discuss. Then the patient becomes silent. And if I understand it right, Dr. Sharma begins experiencing at first his own uneasiness, as any of us would, But it's not only that. I think his uneasiness also reflects the patient's own feeling of anxiety, of will this be tolerated? If I'm not doing what's expected of me in therapy, will you tolerate me or throw me out? With the fear of being thrown out. And I think Dr. Sharma very well tolerated it, realized it was important, and then comes this very interesting thing. A therapist, sometimes you can go into a session, you've seen other patients, you feel very alive, and all of a sudden with a patient you start in feeling like you could go to sleep at any minute. It's a very interesting kind of thing, not under your control whatsoever. Usually, in my experience, most of the time that happens, it's when a patient starts dissociating feelings that are coming up in the therapy with the therapist. Often feelings of anger at the therapist and all. And what one finds, when we interact with each other, I think there's a certain energy that goes back and forth that keeps one alive. You give out the energy, the other person to you. If you're with someone who's dissociating the feelings, that the feelings are entirely cut off, it will send you asleep. So I think some of that was going on. But then Dr. Sharma has the interesting experience of his sleepiness becomes actually something, I don't know if one would quite say enjoyable, but pleasant. Very pleasant, of being in the, sort of, I think, lulled in the arm as a very small child, infant, whatever, the arms of one parental figure or another, being comforted and held and all. And I'm wondering, there's a speculation, of course, if he wasn't then experiencing something of the patient's own regression in this silence, that after all, he said, this patient is not someone totally disabled. He has some wish, some strong wish to work out these problems that he has. And I wonder if there wasn't, in his early childhood, as he even said, he would be joyful and whatever, this very comforting presence. It's only as he gets somewhat older in childhood that this very conditional acceptance of him gets expressed, that he must be a certain way. And in fact, I think that's what makes it so difficult in relationships, that he feels if he's close to someone, he'll lose himself. He has to take the other person's perspective, as well as what Dr. Sharma talked about. Anger could come up too, of there being this conditional acceptance, and in fact, I think the rage has to be, to a great extent, either contained, repressed, or dissociated, because if the relationship is very conditional, anger at the other will lose the relationship. That's the feeling. So I think there's the testing of Dr. Sharma would continues with the asking questions of him, but let me just say another comment about silence. In psychoanalysis, silence had been really considered as a resistance, that you were holding back something, often feelings about the therapist. But there was a very interesting paper written in America, no less by an Indian Bengali woman in psychoanalysis herself and in training to be an analyst, who happens to be married to Salman Akhtar now.
Oh, Dr. Monisha.
Monisha, yeah. And what she did, and she finally convinced her own analyst, and she cited some poems by Rabindranath Tagore, that silence can also be a way of being more in touch with yourself, not necessarily as a resistance. And she had to convince her therapist of this, but she wrote a paper that went against the prevailing psychoanalytic notions of silence. But I think this continued in asking question of Dr. Sharma, feeling again, anticipating his anger, that the patient will be thrown out of therapy. So there's a testing of him, I would see, as how conditional is this relationship? And I think that there's at times some, if you wish, regression to withdrawing and all. It's not that the therapy hasn't been successful, but there needs further work. Because his being, I think, with the, not only the fear of being thrown out, but the fear of his own anger going out of control. But I think, at least as I see it, there was considerable, extremely important movement in a very nice handling of the transference relationship as it went on with Dr. Sharma. Okay, that's my comment on it.
Anyone would like to put any question to Dr. Roland, or otherwise we would just regarding morning or this case or whatever, yeah.
Basically, person has many relationships in his childhood, his or her childhood. So how do you figure out that whether are you resembling with the mother or father or the grandmother of the child?
The person has many relationships with their family. Also, how do you figure it out in the transfers, that what sort of transfers? I mean, are they seen as a mother, as a father, as a grandmother, as a dog?
That's a very good question, especially this patient comes from a joint family where it can be any number of people. And not only that, but often you have to see, say if it is with a given parental figure, what aspect of the mother or the father is there a problem? Because we're not all made of one piece, and the parents are not all made of one piece either, so that different things can come out with different aspects of them. How would you know? I would say there is, and I think it was rather intense in this case, a very conditional relationship. If the mother had a real, on the whole, more acceptance, loving acceptance of the patient, and it was the father who was like this, I don't think it would be so extreme. So I think a lot came from the mother or the mothering persons, but I think it sounds like it was joined in by the father and maybe by others too, because there was also, I think, the fear of probably in the joint family of how this son would reflect on the family. in fact, in his doing fairly poorly in school, I found and worked with some Indian patients that if they were told or forced to do something, they could not disagree with it and not do it. They had to go along, but it was done poorly.
That's a big question.
Yeah, in fact, I know someone who became a major psychiatrist at VIMHANS from a shepherd background, and his father was a shepherd, but very interested in a committed Gandhian. This man was the first man from his community to go to college. He wanted to go to an engineering college. The father wanted him to go to medical school so he could help others. So he had to go to medical school. He said, I did so poorly in medical school that the only job I could get was in the army. And there I became interested in others' emotional problems. So I went on into psychiatry, then went over to England, was trained at Tavistock, and came back. I mean, that's just one example of this, but I know of others. And I think there's some aspect in this case of I can't express my rage directly, but by doing poorly, this won't enhance family reputation. This will get back at you too.
Anyone else?
In reference to this case, because his family had to leave the rest of the joint family because of some issue between his uncles, could that also add to the feeling of conditionality to relationships? You know, that they were a family once, but now they can't live together because somebody did something.
Yeah, that one has to see very specifically what has gone on in the family, how it's affected the parents and the child, and I could give you one example of that, which also ties in with transference, countertransference. I was seeing an Indian woman in New York, and she was actually having a lot of, she was a very bright woman who was accepted at Ivy League colleges, etc. And at one point she went on into psychiatry herself. And the program she was in had a psychoanalytic training program also attached to it. And one day she walked, meanwhile she'd been telling me that one of her problems is she never feels very comfortable with other Americans. Only with Indian Americans, but not with those from a European background. And she assumed, well, you know, she's Indian. She came over to the United States when she was 5. So, at the time, if she went into that psychoanalytic program, she could not continue an analysis with me. And I felt like I was being abandoned, etc. But as I say, I've learned enough not only not to take it personally, but to see how it ties in with her. And the way it tied in with her was in this joint family in which she was raised in a North Indian city. She was the first grandchild. She was adored by all the aunts, uncles, grandparents, whatever. In fact, she said They had 50 different terms of endearment for her. Somehow, something happened in the family, I'm not sure of the details, where her father decided to immigrate to the United States. He didn't have to economically. This was a well-off family. But he did. The mother, as was not uncommon in those days when there were fewer Indians in the United States, became rather depressed and had a difficult time because she felt very isolated, the father less so at work. But the daughter lost the whole feelings of the closeness and endearment within the joint family. And actually, this was my feeling that I was having, that she was feeling, of being cut off, potentially cut off and abandoned. And it was from that that we figured out that the unease with other Americans was actually related to her feeling cut off from the family, that she would never have them again. So you certainly want to see, as much as one can, what the effects are within the whole family system and how this is affecting the patient. And I know it is much more complex here than it is within most Western countries.
Okay, then I think, though one can really go on with this, but I think we need to stop. And so I just thank you all for being here and being such a good such a good contributing audience, in fact, to the kind of issues you have raised. I would like to really thank Dr. Roland for being here, and we hope to see you again, for maybe something for a 2-day thing than a 1-day thing at least. Yeah. And so we'll stop here. Please do fill in the feedback forms. Also mentioning, if you want, the future things to go, in a certain topic or some specific topic that you have in mind. Some topics are already given, but if you want to add something from your side, please do mention that. Do write about this event, and then you can leave these forms outside on the desk and pick up your certificates from there. Okay?